In today's video, you'll discover the top 10 symptoms that appear early on your skin when you have diabetes. Diabetes is a chronic disease that occurs when the pancreas doesn't produce enough insulin or when the body can't effectively use the insulin it produces. Recognizing the signs of diabetes is crucial for early diagnosis and effective treatment, minimizing the risk of serious complications. The skin, being the body's largest organ, can be a visible indicator of diabetes and insulin resistance, so if you have 3 or more of the symptoms mentioned in the video, it's essential that you schedule an urgent medical appointment. First symptom: acanthosis nigricans. Acanthosis nigricans is a notable dermatological symptom, characterized by thickened and darkened areas of the skin, often with a velvety texture. These changes are most common in body folds such as the neck, armpits, groin, and can also appear on elbows and knees. Although it can affect individuals of any age, it is especially prevalent among those who are overweight or obese. The relevance of this symptom transcends aesthetics, as it signals significant underlying conditions, with the most common being insulin resistance, a precursor to type 2 diabetes. Insulin is a vital hormone that regulates blood glucose levels. When the body doesn't respond adequately to this hormone, insulin resistance develops, leading to high levels of insulin in the blood. This excess stimulates abnormal growth of skin cells, resulting in the characteristic appearance of N. Therefore, the presence of N not only indicates an increased risk of developing type 2 diabetes but may also suggest inadequate glycemic control in people already diagnosed with the disease. In addition to its association with insulin resistance and diabetes, N may be linked to other health conditions such as polycystic ovary syndrome and obesity. Necrobiosis lipoidica. Necrobiosis lipoidica is a rare and complex skin condition often associated with diabetes. It is characterized by round or oval lesions with a yellowish center and reddish borders, typically appearing on the legs. Although the exact cause is unknown, it is believed to be related to changes in blood vessels and chronic inflammation, with diabetes being a significant risk factor. Interestingly, not all people with necrobiosis lipoidica have diabetes, but many develop the condition over time. The lesions can be painless but are prone to injury, leading to difficult-to-heal ulcers. The connection between necrobiosis lipoidica and diabetes highlights the importance of strict blood sugar control. Although there is no cure, treatment aims to minimize symptoms and prevent complications. Options include topical or injected corticosteroids to reduce inflammation and, in some cases, laser therapies to improve the appearance of lesions. Male pattern baldness. Male pattern baldness, also known as androgenetic alopecia, is a common condition that affects many men, characterized by hair loss on the top of the head and temples. Although often seen as a sign of aging or a genetic issue, recent research suggests a possible connection between male pattern baldness and diabetes, specifically type 2 diabetes. Insulin resistance, a precursor to type 2 diabetes, can affect the health of hair follicles, potentially accelerating hair loss in individuals genetically predisposed to baldness. Additionally, the systemic inflammation associated with diabetes can compromise blood circulation, negatively affecting the hair growth cycle. While baldness itself doesn't cause diabetes, the presence of both may signal the need to closely examine an individual's metabolic health. It is important for men who notice early hair loss or have a family history of diabetes to consult a doctor for proper evaluation and guidance. This way, proactive strategies can be adopted to mitigate risks and manage both conditions effectively. To confirm your glucose levels in the body, check the pinned link in the video comments. Hidradenitis suppurativa. Hidradenitis suppurativa, HS, is a chronic and painful skin condition characterized by nodules, abscesses, and scars, mainly in areas such as the armpits, groin, and under the breasts. This link between HS and diabetes may be partially explained by chronic inflammation and insulin resistance, both common in people with type 2 diabetes. Insulin resistance increases inflammation in the body, which can worsen HS symptoms or even contribute to its onset. Diabetic blisters or bullosis diabeticorum. Diabetic blisters, also known as bullosis diabeticorum, are a rare but distinctive skin condition that can occur in people with diabetes. They manifest as large, painless blisters, similar to second-degree burns, suddenly appearing on the skin. Typically, these blisters appear on the hands, feet, legs, and arms. Fortunately, diabetic blisters tend to heal on their own, usually without scarring, within a few weeks. The key to management is to keep the blisters clean and protected to prevent infections. Additionally, it is crucial to monitor and maintain blood glucose levels within a healthy range to prevent the emergence of new blisters and other diabetes-associated complications. Skin tags, scientifically known as acrocordons, are small skin protrusions that often appear in body folds such as the neck, armpits, under the breasts, or in the groin. While they are not painful or dangerous on their own, these tags can be an external sign of more serious internal conditions, such as insulin resistance and type 2 diabetes. The relationship between acrocordons and diabetes lies in the fact that both are often associated with metabolic changes, including high levels of insulin in the blood. Rosacea. Rosacea is a chronic inflammatory skin condition characterized by facial redness, small red bumps, and sometimes visible blood vessels, mainly on the cheeks, nose, chin, and forehead. People with diabetes, especially those with inadequate glycemic control, may experience a state of chronic inflammation in the body. This inflammatory state can contribute to the development or worsening of rosacea in predisposed individuals. In addition to glycemic control, general recommendations for managing rosacea include avoiding known triggers that may worsen symptoms, such as spicy foods, alcohol, and sun exposure, as well as following a skincare routine recommended by a dermatologist. Xanthelasma. People with diabetes have a higher risk of developing lipid disorders, which can lead to the accumulation of cholesterol deposits in various parts of the body, including the eyelids. This means that, while xanthelasma itself does not cause pain or direct damage to vision, its presence may signal the need to assess and manage blood cholesterol and glucose levels more closely. Acne or acne vulgaris. Acne or acne vulgaris is a common skin condition that affects most people at some point in their lives. Characterized by pimples, blackheads, and sometimes cysts, acne arises due to clogging and inflammation of hair follicles. Individuals with diabetes, especially when not adequately controlled, may experience significant fluctuations in glucose levels. These fluctuations can affect the skin in various ways, including altering the skin's barrier function, which can potentially lead to the development or worsening of acne. Additionally, insulin resistance, common in type 2 diabetes, may stimulate the production of androgens, male sex hormones, which in turn can increase sebum production, contributing to follicle blockage and the emergence of acne. For those suffering from acne, a good skincare routine is essential. This may include gentle cleansing of the skin using non-comedogenic products. Skin ulcers. Skin ulcers are open wounds that do not heal or heal very slowly. They are a serious and common complication in people with diabetes, particularly those who suffer from diabetic neuropathy, a condition that reduces sensitivity in the feet and legs, diminishing the ability to feel pain and, consequently, to notice wounds or cuts. Poor circulation, another adverse effect of diabetes, also hinders the arrival of oxygen and essential nutrients to the skin, further compromising healing. I hope this video has helped you to clear up some doubts. Please comment on which of these symptoms you have been experiencing and follow our channel for more content like this. Until the next video.